Top 25 Counselor Interview Questions and Answers. Counseling is a profession that requires empathy, communication skills, emotional intelligence, and a deep understanding of human behavior. During a counselor interview, employers often assess not only your professional knowledge, but also your ability to handle sensitive situations, build trust with clients, and maintain ethical standards. Preparing for common counselor interview questions can significantly improve your confidence and performance. In this guide, you will find 25 commonly asked counselor interview questions along with detailed answers. These questions focus on counseling techniques, problem-solving abilities, communication skills, and professional ethics to help you prepare effectively. 1. Why did you choose to become a counselor? I chose to become a counselor because I am passionate about helping people overcome emotional, personal, and psychological challenges. Counseling allows me to support individuals during difficult moments in their lives and guide them toward healthier coping strategies. I enjoy listening to people, understanding their perspectives, and helping them find solutions that improve their well-being. The profession also allows continuous learning about human behavior and mental health. Becoming a counselor gives me the opportunity to make a meaningful impact by empowering individuals to grow, heal, and build more fulfilling lives. 2. What qualities make a good counselor? A good counselor must possess empathy, patience, active listening skills, and strong communication abilities. Empathy helps counselors understand clients, emotions, and perspectives without judgment. Patience is essential because progress in counseling often takes time. Active listening ensures that clients feel heard and respected. A counselor must also maintain confidentiality and professionalism. Problem-solving skills and emotional intelligence help in guiding clients toward practical solutions. Additionally, adaptability and cultural sensitivity allow counselors to work effectively with individuals from diverse backgrounds and life experiences. 3. How do you build trust with clients? Building trust begins with creating a safe, supportive, and non-judgmental environment. I start by actively listening to the client and acknowledging their feelings and concerns. Maintaining confidentiality is also critical, because it assures clients that their personal information is protected. I communicate honestly and clearly while showing empathy and respect for their experiences. Consistency and reliability help strengthen the relationship over time. When clients feel valued and understood, they become more comfortable sharing their thoughts and emotions, which allows the counseling process to be more effective. 4. How do you handle a difficult or resistant client? When dealing with a resistant client, I focus on understanding the reason behind their resistance, rather than forcing progress. Resistance often comes from fear, mistrust, or discomfort discussing sensitive topics. I remain patient and use open-ended questions to encourage communication. Building rapport gradually can help the client feel more comfortable. I also validate their feelings and let them know their concerns are understandable. By creating a supportive environment and allowing the client to move at their own pace, resistance often decreases over time. 5. What counseling techniques do you commonly use? I use several counseling techniques depending on the client's needs and circumstances. Active listening is essential because it helps clients feel understood. Cognitive behavioral therapy techniques can help clients identify negative thought patterns and replace them with healthier perspectives. Solution-focused counseling encourages clients to concentrate on achievable goals and practical steps forward. I also use empathy, reflection, and open-ended questions to facilitate deeper discussions. By adapting techniques to each individual client, I can provide more personalized and effective support. 6. How do you maintain professional boundaries with clients? Maintaining professional boundaries is essential to ensure ethical and effective counseling relationships. I clearly define the counselor-client relationship from the beginning, explaining roles, expectations, and limitations. I avoid sharing excessive personal information and ensure interactions remain professional. Scheduling sessions within professional settings and respecting confidentiality also help maintain boundaries. If a client attempts to cross professional lines, I address the situation respectfully while reinforcing the importance of maintaining a therapeutic relationship focused on their well-being. 7. How do you handle confidential information? Confidentiality is a fundamental principle in counseling. I ensure that all client information is kept private and stored securely. I only share information when legally required, such as when there is a risk of harm to the client or others. At the start of counseling, I explain confidentiality policies so clients understand their rights and limitations. By strictly following ethical guidelines and professional standards, I help maintain trust and protect the privacy of every client I work with. 8. How do you help clients set goals? Helping clients set goals begins with understanding their challenges, needs, and aspirations. I encourage them to identify what they hope to achieve through counseling. Together, we break larger goals into smaller, manageable steps that feel achievable. I ensure the goals are realistic, measurable, and relevant to their personal growth. Regular progress reviews allow clients to reflect on their achievements and make adjustments when necessary. This structured approach keeps clients motivated and focused on positive change. 9. How do you handle emotionally intense sessions? Emotionally intense sessions require empathy, patience, and calm communication. I allow the client to express their feelings openly without interruption or judgment. Maintaining a supportive presence helps clients feel safe during difficult emotional moments. I use grounding techniques and encourage deep breathing or reflection to help them regain emotional balance. After the intense moment passes, we discuss the emotions and explore constructive coping strategies. My goal is to ensure the client leaves the session feeling supported and understood. 10. How do you stay updated with counseling practices? I stay updated by regularly reading research articles, attending professional workshops, and participating in training programs related to counseling and mental health. Continuing education helps me learn about new therapeutic techniques and best practices. I also engage with professional counseling communities where experts share insights and experiences. This ongoing learning ensures that I provide effective, evidence-based support to my clients while maintaining high professional standards. 11. How do you manage stress as a counselor? Managing stress is important for maintaining effectiveness as a counselor. I practice self-care activities such as exercise, meditation, and maintaining a healthy work-life balance. Regular supervision or peer discussions also help me reflect on challenging cases. Taking breaks and setting emotional boundaries prevents burnout. By managing my own well-being, I can remain focused, compassionate, and fully present when supporting clients. 12. How would you help a client dealing with anxiety? I would start by understanding the client's triggers and experiences with anxiety. Then I would help them identify negative thought patterns that may contribute to their stress. Teaching relaxation techniques such as deep breathing and mindfulness can help them manage symptoms. Gradually, I would guide them in developing coping strategies and practical steps to face anxiety-provoking situations. The goal is to empower the client with tools that help them manage anxiety independently over time. 13. How do you handle cultural differences with clients? Cultural sensitivity is essential in counseling. I approach each client with respect and openness toward their cultural background, beliefs, and values. I avoid assumptions and encourage clients to share how their culture influences their experiences. By educating myself about diverse cultures and maintaining an inclusive mindset, I can provide support that respects their identity. This approach strengthens trust and ensures counseling strategies are culturally appropriate. 14. What would you do if a client refuses your advice? If a client refuses my advice, I respect their decision because counseling should empower clients to make their own choices. Instead of insisting on my suggestion, I explore their concerns and perspectives. I may present alternative options and discuss possible outcomes. My role is to guide and support rather than control their decisions. Encouraging open dialogue allows clients to reflect on their choices and take responsibility for their personal growth. 15. How do you motivate clients who feel hopeless? When clients feel hopeless, I focus on rebuilding their sense of possibility. I start by acknowledging their emotions and validating their experiences. Then, I help them identify small, achievable goals that create a sense of progress. Celebrating small successes can gradually improve their confidence. I also highlight their strengths and past achievements to remind them of their resilience. Over time, these positive steps can restore hope and motivation. 16. How do you deal with ethical dilemmas in counseling? When faced with ethical dilemmas, I follow established professional guidelines and ethical codes. I carefully evaluate the situation, considering the client's best interests and legal responsibilities. Consulting supervisors or experienced colleagues can provide additional perspectives. Documentation of the situation and decisions made is also important. By prioritizing ethical standards and client welfare, I can handle challenging situations responsibly. 17. How do you assess a client's needs? Assessing a client's needs involves careful listening, observation, and structured questioning. I begin with an initial assessment where clients share their concerns, background, and goals. I evaluate emotional, behavioral, and environmental factors that may influence their situation. Sometimes standardized assessment tools are used to gain deeper insights. This process helps identify the core issues affecting the client. With a clear understanding of their needs, I can develop a personalized counseling plan that focuses on their priorities and supports meaningful progress over time. 18. How do you encourage open communication with clients? I encourage open communication by creating a safe and non-judgmental environment where clients feel comfortable expressing themselves. I use active listening techniques and ask open-ended questions that invite deeper conversation. Showing empathy and understanding helps clients feel valued and respected. I also reassure them that their thoughts and emotions are valid and important. Over time, this supportive approach builds trust and encourages clients to share more openly about their experiences and challenges. 19. What role does empathy play in counseling? Empathy is one of the most important skills in counseling because it helps counselors understand the emotions and experiences of their clients. When clients feel that their counselor truly understands their feelings, they are more likely to open up and engage in the counseling process. Empathy also helps create a supportive and compassionate environment. By reflecting emotions and acknowledging clients' struggles, counselors can strengthen the therapeutic relationship and guide clients toward positive change. 20. How do you manage time during counseling sessions? Time management during counseling sessions is important to ensure that discussions remain focused and productive. At the beginning of the session, I briefly review the goals and priorities. I allow clients enough time to express their concerns, while gently guiding the conversation when necessary. Toward the end of the session, I summarize the key points and discuss the next steps. This structured approach helps maintain balance and ensures that every session contributes to the client's progress. 21. How do you support clients experiencing grief? Supporting clients experiencing grief requires patience, empathy, and compassion. I allow them to express their emotions freely without feeling rushed or judged. Grief is a personal process, so I respect their pace and unique experiences. I encourage them to talk about their feelings and memories while helping them develop coping strategies. Over time, counseling can help them gradually adjust to the loss and find healthy ways to move forward while honoring their emotions. 22. How do you evaluate the success of counseling? Evaluating the success of counseling involves reviewing the goals established at the beginning of the counseling process. I regularly check progress with the client and discuss any improvements or challenges they are experiencing. Positive changes in behavior, emotional well-being, and coping skills often indicate progress. Client feedback is also important because it reflects how helpful they find the counseling sessions. This ongoing evaluation helps ensure that counseling strategies remain effective and relevant. 23. How do you handle a client in crisis? When a client is in crisis, my priority is ensuring their safety and emotional stability. I remain calm and provide immediate emotional support while carefully assessing the situation. If there is a risk of harm, I follow appropriate emergency protocols and seek additional support from professionals or authorities when necessary. I also help the client identify immediate coping strategies and resources. Once the crisis is stabilized, we can work together on long-term solutions and support systems. 24. How do you adapt your counseling style to different clients? Every client is unique, so I adapt my counseling style based on their personality, needs, and communication preferences. Some clients respond well to structured goal-oriented approaches, while others benefit from more open and exploratory conversations. I also consider cultural background, emotional readiness, and personal values when choosing counseling techniques. Flexibility allows me to provide more effective support because the counseling process becomes tailored to each individual's circumstances. 25. Why should we hire you as a counselor? You should hire me as a counselor because I bring strong communication skills, empathy, and a genuine commitment to helping individuals improve their well-being. I am dedicated to creating a supportive environment where clients feel comfortable sharing their concerns. My approach focuses on understanding each client's unique situation and providing practical strategies for growth. I am also committed to continuous learning and professional development, ensuring that I apply effective counseling techniques while maintaining ethical and compassionate care. Preparing for counselor interview questions is essential for demonstrating your professional skills, empathy, and ability to support individuals facing emotional or personal challenges. Employers want counselors who can communicate effectively, maintain confidentiality, and apply appropriate counseling techniques. By understanding the purpose behind common interview questions and preparing thoughtful answers, candidates can present themselves confidently and professionally. The questions and answers provided in this guide can help you strengthen your interview preparation and increase your chances of success in securing a counseling position.